Campaign 2020 is sponsored by Wisconsin Hospital Association, Quick Trip, Wisconsin Counties Association, Wisconsin Realtors Association, and Wisconsin Operating Engineers Local 139.
Melisa Arndt of Rio is a Democrat running in the 42nd Assembly District. Melisa, welcome to WisconsinEye.
Thank you for having me, Steve. Nice to meet you.
Well, you're a nurse. So here's my question. On September 28th, the governor must decide, extend the statewide mask edict or let it lapse. What do you think, Miss Nurse?
Well, to clarify, I am a nurse. I'm a licensed practical nurse, a little bit different than a registered nurse. A lot of the same tasks and whatnot fall underneath that. But as a medical professional, former EMT, I do think that the mask mandate has helped when it has been taken place in places that are enforcing it. Masks are helping to stop the spread of COVID. I do feel like it should be a continued resource until we can find better ways to make this more manageable. As always, it's always good hand washing, good hygiene. Put that mask on. It actually is helping when everyone's using them correctly.
So you've been studying the pandemic. I'm just curious, how concerned were you that on Sunday, we hit a positive rate of 20.5%? Highest ever. Help me understand that, please.
I wish I could help you understand that. I unfortunately am not a statistician. I am a medical professional in a outpatient setting, but I am a concerned citizen that has a UW student that lives off campus, however, but still, very concerned about the spread, and especially within the UW system, things that are happening. It's not turning the way that we would like to see it turn. And I think that if we all took it a little more seriously, we'd be able to get past this and get towards the next steps, which would be a vaccine. But like I said before, good hygiene, same thing we do during flu season.
Oh, thank you, Melisa. Well, but let's talk about it from a state budget standpoint. There are concerns that the pandemic is going to cut into tax collections. And I'm making up a number here. If we collect $1 billion less and you're in the legislature, would you opt to raise revenues, taxes, or fees, or cut spending, please?
I suppose you're not going to let me go with a little bit of both, are you?
Oh, no, it's your answer, so go with a little bit of both, but explain.
Well, I really think that it's going to have to, we are going to have to look at both. We're going to have to utilize some of that rainy day fund that has occurred over time to get through these unusual times. We are going to have to look at balancing that budget through different cuts, hopefully not in healthcare, because we've already suffered enough in the healthcare and education aspect in the state with the current legislation. So I think it is going to have to be both. I'm not a current legislator, so to be able to look at those, I would have to get in there to have the conversations that the legislation keeps talking. We have to have these conversations. However, it's been well over 100 days since anyone's had conversations. So these are conversations we should have right now.
We've seen the role that hospitals play nationally in Wisconsin treating COVID-19 patients. If you're a legislator voting on the next state budget, do hospitals deserve an even bigger priority than they may have in the current budget, please?
Well, they need a seat at the table to have the conversation about how it's impacting the healthcare in the state, for sure. I guess if you could reframe that question.
Should hospitals get even more of a priority in the next state budget because of the role that they have been playing here on the front lines of the COVID pandemic?
If they are lacking in all ways that the rest of the state is lacking in, as far as budgets and revenue, then I think they should be, equally addressed. I don't know if it would be more or less. I guess I would have to have a little more information.
Yeah, I understand. Senator Chris Kapping has introduced a bill that says if your business or organization has adopted the CDC protocols or some protocols to protect employees, patients, and customers, you should not be sued. You could not be sued over a COVID issue. Do you support that law?
In theory, the way it sounds just in that single sentence, it sounds fabulous. Whether it would be truly considered flagrant or, the lawsuit would actually have any substance to it would be questionable in those terms. So I don't know if it would be feasible to do or not.
Okay.
I'll get back to you on that one.
Thank you. The governor's got what he calls a plan that the People's Maps Commission would draw the next congressional and legislative district lines. The Constitution says it's up to the party in power in the Capitol. Where do you come down on that issue, please?
Well, the party in the power is always going to be the party in power if we don't change the party in power. And the only way to change party in power is by changing the party in power. You see where I'm going with this?
Yes,
The People's Maps Commission is definitely a needed resource, and it has been, in years past. It's not Democrat, it's not Republican, it's the state. The state constituents should be choosing their legislators. The legislators should not be choosing their constituents.
As states around Wisconsin legalize recreational and medical marijuana, what's your position, please?
So my position, I have an interesting position on this because I am a nurse in the, automatically people are going to assume that I'm okay or not okay one way or the other with just medical marijuana. But I'm actually in support of both recreational and medical marijuana, specifically because it is something that is going to already be in our areas. Our kids, the students, the adults, it's out there already. And we are so far behind in the state in utilizing those resources. The tax revenue from the marijuana sales alone it's ridiculous that we haven't at least had the conversation. We seem to be gaveling in and out of a lot of conversations that need to be had. We can't do that at home as parents. We can't do that at our jobs. How can we do that at the state?
The debate that we've seen nationally and in Kenosha over policing reforms. Mm-hmm. The governor has 9 bills. Senator Weingart has 8 bills. The police union has, and the Speaker Voss is going to form a task force. What policing reforms do you think should be enacted?
There are quite a few bills that are evidently on the table. It doesn't appear that anyone's really talking about them, as long if it seems that if it's not someone's idea, or if it's a D or an R behind the idea, that nobody can find any agreement on that. I really think that we need to have the police involved in the conversation, the constituents involved in the conversation. It does, as far as this task force that the speaker is initiating, if it's done the way that it's stated is going to be done, I'm all for it. I really think that a task force should be getting together. I think it's long past due to be having these conversations and getting some of these, some of these bills addressed and enacted.
Is there any one policing reform you think should pass? Anything specific?
So the chokehold.
Chokehold ban. Okay.
Yeah. I think that's obviously, something that needs to be addressed.
Wisconsin is a high property tax state, which is why for 20 years, local governments, schools and local governments have been dealing with caps and limits on what they can levy in property taxes. So if you're elected to the legislature voting on the next state budget, should those caps and limits on property taxes stay in place?
So if our next state budget is reflective of an equitable school budget for our education plans for our different districts, then I guess it's a if this happens then this would happen type of question, because right now I know that I've made phone calls and knocked doors for my school district that my kids go to. Every few years we're knocking doors for referendum because there simply is not enough in that fund, and it's gone down for our school district particularly. So I guess it really does need to be more localized as far as the property tax. Nobody wants to see their taxes go up, but we also want to see good education platforms. So it's been a conversation we've had for how many years? Since I was a Madison East High School student. this conversation's been had.
Do local governments, to reduce their reliance on property taxes, do they need more sources of revenue?
They do.
And specific examples, Representative Goyke from Milwaukee, a Milwaukee Democrat, says Milwaukee, if you pass a referendum, should have a 50-cent sales tax. So is that the type of thing that we should consider giving local units of government?
Potentially, for at the county level. Sure, I can tell you my Columbia County board will probably not be on board with that, and many of the constituents wouldn't be either, just because some of the school districts are able to manage at the cap level. Are we still talking about the cap level here?
Well, no, we're talking about new sources of revenue.
New sources of revenue.
New sources of revenue.
Yeah, well, let's backtrack to some of the options of the gas tax that we're talking about, and heading on back to that marijuana bill. Let's have these conversations. These are taxable. These are things that we could be utilizing for the state, and we're not.
You mentioned the gas tax. Last year, Governor Evers wanted, the gas tax now is 30.9 cents, hasn't been raised in, 10 years or so. He wanted to raise it last year. Are you willing to support a gas tax increase?
I am.
How many pennies? Got a thought?
I would need to have a conversation. I don't have any pennies. I don't have any thoughts on pennies, I should say.
Okay. If a school district or local government plans a major public works project, should they have to give a preference to Wisconsin businesses?
Well, I think it's the right thing to do. I think it's the Wisconsin way to do something like that. I believe that, in my heart of hearts, if everyone is bidding correctly and considering their own communities when they're offering these bids for people, that they would be fair and just. But there are unfortunately situations where that's not going to occur. So I believe that if it's a fair and just bid, I think that preference should go to Wisconsin. There's plenty of cancel culture going on in the world right now, and I'm not huge on it. I still want to support Wisconsin business. Whether you support my campaign or my opponent's campaign, I'm going to support Wisconsin business, and that's supporting Wisconsin constituents.
We've talked a lot about specific issues. Is there any important campaign theme or issue that you want to that we haven't discussed yet that you want to bring up now, Melisa?
The biggest thing that I want to just represent is the need for healthcare expansion. I don't know the Medicaid expansion that's been declined, the federal Medicaid expansion. I don't know why we're not taking it. I'd like to know more about that. If my representative can tell me more and explain why we're not accepting that, why we're voting no on that, then, that would be a nice conversation to have. That's one of the things as a healthcare worker that is aware that many people are right now in the middle of this pandemic. They're attached to their healthcare through their employer, and people that are losing jobs are service industry workers that are losing employment. I have patients every day that they no longer have insurance and they're calling for this, that, or the other, and they need assistance. And there's only so much going on that we can do in the private industry to support that. And we are doing what we can in the private industry to do that. But we need to really do more as a state to take care of our folks, especially right now.
Besides the Medicaid expansion, any other differences between you and your opponent on November 3 you want to highlight?
Well, I have never been a politician before, so this will be interesting. I am a clinic director, so I do know how to manage an office already. But I'm not looking to become a career politician. I want to go into our district and listen to the people that have concerns, what their actual concerns are, and vote based on their concerns and the policies around them. I'm not here to vote for a party. I'm here to vote for a policy.
Thank you. Melisa Arndt of Rio is a Democratic candidate in the 42nd Assembly District. The election is November 3. Melisa, thank you for talking to WisconsinEye.
Thank you so much, Steve. Have a great day.
You too. Thanks.
Campaign 2020 is sponsored by Wisconsin Hospital Association, Quick Trip, Wisconsin Counties Association, Wisconsin Realtors Association, and Wisconsin Operating Engineers Local 139.